Right. Yeah.
Have you?
Okay, sounds good. Good evening. Nice chilly night. We can get started. I'd like to call the organizational meeting of Stark County Board of Developmental Disabilities to order. We will call at 6:03. And as we know, we need to have this organizational meeting by January 31st of each year. We'll start with having oath of office. We're pleased to have Commissioner Bill Smith administer oath of office for Dr. Jessica Falvo-Lang and Marie Higgy.
Maria?
Yes,
You ready?
I'm ready. You like me to order it?
Let's see. What do you want to know? Okay. Okay. Yeah. Yeah, well, all right. Let's see. Okay. Ready? All you have to do is answer.
Yeah.
Maria Higgy, do you solemnly swear that you will support the Constitution of the United States and the Constitution of the State of Ohio, and that you will faithfully and impartially discharge your duties as a member of the Stark County Board of Developmental Disabilities to the best of your ability and in accordance with the laws and the rules and regulations of the board now in effect and hereinafter to be enacted during the continuance of said office and until your successor is appointed? If so, the answer is I do. Maria, I thank you for the commitment to Stark County community, and I hereby name you to the Board of Developmental Disabilities. Congratulations, and I thank you in advance for your service.
Thank you.
Dr. Falvo-Lang, do you solemnly swear that you will support the Constitution of the United States and the state of Ohio, and that you will faithfully and impartially discharge your duties as a member of the Stark County Board of Developmental Disabilities to the best of your ability and in accordance with the laws, the rules, and regulations of the board now in effect and hereinafter to be enacted during the continuance of the said office and until your successor is appointed, if so, and the answer is I do. Dr. Falvo-Lang, I thank you for your commitment to Stark County community, and I hereby rename you to the Board of Developmental Disabilities. Congratulations, and I thank you for your continued service. Thank you. Just a moment here. I guess I'll just take a moment and thank everyone for their commitment to developmental disabilities. I'll tell you what, I've got, relatives obviously in the program, but so I know a little bit about, and I do thank you. The entire county thanks you for your diligence and your commitment. Okay, it takes a lot. So thank you very much. As from the Board of Commissioners, we all thank you. So,
Thank you.
thank you for the input.
Commissioner Smith, thank you for being with us tonight, and thank you for your service to our Stark County. And congratulations to Maria and Falvo-Lang. Now we'll go to roll call. Jim Anderson.
Present.
Dr. Falvo Lang,
Here.
Maria Hickey,
Here.
Jennifer Moth,
Here.
Carmelita Smith,
Here.
Cindy Sutter is excused. Dan Sutter here. Go to election of officers. The nominating committee made up of board member Maria Hickey as chair, Dr. Falvo Lang and Cindy Sutter propose the following 2022 slate of officers. President Dan Sutter, Vice President Carmelita Smith, and Recording Secretary Dr. Falvo Lang. Any motion for board resolution 010122?
Hickey moves.
Second,
Anderson seconds.
thank you. Any discussion from the board members? If not, all in favor of the resolution, say aye.
Aye.
Opposed, say nay. Any abstentions? No abstentions? Thank you. The resolution is approved. So during the organizational meeting, we set the schedule for board meetings for the year. There's a copy of a tentative schedule in the board packet, which has us meeting the fourth Tuesday of the month, except in February, June, and December. Are there any questions or concerns with the proposed schedule? If none, this will be the schedule for the regular board meetings for the year. And we move to the committee assignments. For Ethics Council, we have Jim Anderson and Maria Hickey. Personnel Committee will be Cindy Sutter, Carmelita Smith, and Maria Hickey, and Maria will chair. For the Finance Committee, we have Dr. Falvo Lang as chair, Jennifer Moth, and myself. Then the Nominating Committee, Maria Hickey to chair that committee, and Dr. Falvo Lang and Cindy Sutter will be on the committee. The nominating committee will meet prior to December 31st of 2022 to propose a slate for the 2023 calendar. Finance Committee meetings will be held at 4 p.m. on the Monday, 8 days prior to the board monthly board meetings, and Personnel Committee meetings will be held at 3 p.m. on the Friday before board meetings. Draft schedules. These schedules of the meetings are in our board packets. Are there any questions or concerns for the proposed time schedules? Given the new committee assignments, so we can set new dates and times for committee meetings if there are no proposed changes. These will be the schedule for the finance and personnel committees for 2022. In our board packets, we've got the ethical code of conduct declaration and conflict of interest declaration. Each year we sign these two, and both of these are in our booklets this evening. Please review and sign these documents and turn it in to Katrina following the meeting, if at all possible.
We can also send those electronically if you'd be interested in doing an online signature.
Okay. Sounds good. Thank you. Then we have the annual board self-assessment and the board assessment. Within our board packets is the annual board and self-assessments that we each completed. Upon review and the feedback, it seems we're functioning well, but also want to get better with improvements. We'll be working with Bill and staff to follow up when necessary. And thank everyone for completing those assessments. Good information is springboard for us going into 2022. And that brings us to board and service topics. To date, we've received the Ohio Department of Developmental Disabilities recommended training topics, but would like to again do 2 one-hour trainings in person and 2 trainings via Relias, the online voting system. And from feedback from our board member assessments, our training wants, needs, and interest topics. They would include becoming more knowledgeable about the agency's history, mission, and values, the social and economic trends and issues that affect the agency, our upcoming levy, and managing through the workforce crisis. So please let me know if these meet our needs. Let's plan for our first board training to occur after board meeting in April, and propose the second one to be after the September meeting. The 2 additional Ours will be through Relias, the agency's learning management system. And I'll direct Bill and staff to ensure the feedback provided within our self-assessments is addressed. Any other business that we have for the organization? Any questions or concerns we haven't covered? If none, this will conclude business of the organizational meeting. I need a motion to adjourn.
Calvin Lang moves.
In a second.
Not
And-
second.
Thank you. All in favor, say aye.
Aye.
Opposed, say nay. Abstention. The organization meeting is now adjourned at 6:13. Okay, we'll move to the regular board meeting for January. It's now called to order at 6:13. We'll dispense, forego the roll call since we previously took roll call at the organizational meeting. And then we'll move into the memorial. Extend our sincere condolences to the families of the following people who have passed away since our last meeting. We've got several. Ralph Oscar Chris. Ralph, age 84, passed away Thursday, November 30th. He received services from the SSA department. William Billy Michael Maroney. Billy, age 58, passed away Sunday, December 12th. Billy received services from the SSA department. Previously attended the closed workshop program. Danny Ellis Morris. Danny, age 60, passed away Tuesday, December 14th. Danny previously received services from the board's workshop program and the SSA. Shelby Rastel. Shelby, age 79, passed away Wednesday, December 22nd. She received services from the SSA department and previously attended the board's workshop program. Anthony David McLean. Anthony, age 24, passed away Thursday, December 23rd. He received services from the SSA department. Richard McCulley Sr. Richard, age 71, passed away Thursday, January 6th. He received services from the SSA department. Marianne Miola. Marianne, age 64, passed away Thursday, January 6th. She previously attended the Stark County Board Workshop Program and received services from the SSA. Heather Marie Hostetler. Heather, age 27, passed away Monday, January 10th. She received services from the SSA department. John M. Summers. John, age 62, passed away Friday, January 14th. He received services from the SSA department. And Ann Hanson. Ann, age 30, passed away Friday, January 14th. She received services from the SSA department. And we have a previous employee, Tammy Christine Garner. Tammy, age 54, passed away Thursday, December 30th. Tammy worked for Start TD for 14 years as a developmental specialist in the early intervention department. She was also involved in the SEPTA union and served as union treasurer for several years. Let's take a moment of silence to honor their lives and passing. Okay, thank you. Now I need a motion to approve minutes from the regular board meeting held December 14th.
Pinky moves.
Second.
Calvin Lang seconds.
Any additions, revisions, or corrections? If none, all in favor of approving the board meeting minutes, say aye.
Aye.
Don't say nay. No abstentions. Minutes are approved. At this time, I'll entertain anyone for public speaks. We thought we have anybody for public speaks, so we'll move on to the president's report. I appreciate your feedback provided in the board assessments and the self-assessments. I did have the opportunity to attend both legislative advocacy meetings with our state representatives, Reggie Stoltzfus and Scott Olslager, and hear the stories that our providers are living with right now. battling with this workforce crisis. Our service delivery system certainly is fragile and can easily move from a crisis to an emergency. And we'll continue to meet with additional legislators to share the multiple issues of the need to enrich rates as well as simplify our system. So with that, I conclude the president's report and then I'll have superintendent's report.
Good evening, everyone as well. Maria, Dr. Febelang, we're glad you're with us for another 4 years. You know, that is cast in stone when you get reappointed like this. We hate to say this, but we do know where you live. Well, good evening, everyone. This evening, we do want to point us to our year one strategic progress report that is before each of you. It's the GREED report. We want to thank Lisa Paramore for her handiwork in putting this together. It's always beautiful. And more importantly, it portrays positive images of the people we support and is very informational. Kudos to the departments also who worked so diligently to make year one a success. The plan's framework is made up of 3 focus areas. It's educate, advocate, and provider relations. And then the plan goes to initiatives, and we have 11 initiatives that we were working on that then have 47 different objectives that we are reporting out on. So a little different than our last strategic plan on how we documented progress. It's really kind of yes we did or no we didn't. It is more narrative and measure driven. But we do want to indicate some of the accomplishments this past year. We increased the number of people using assistive technology from 66 to 81 people. It's literally an 18.5% increase. And that is no small lift, adding that many people to use something that they're unfamiliar with. So kudos to Amy Anderson and Jessica Hobart for them shaping up that technology effort. We implemented a public awareness campaign, and it's starting to show up around the county. I was literally went home and changed, and I came back and I followed one of our buses, and there was Milk for Good. So it was a great advertisement for us. But we're going to see it on billboards and social media here. It's going to penetrate all over Stark County this year. We increased the number who are competitively employed by 10. We now have 259 people competitively employed working at businesses throughout our community, which is really, really a great accomplishment. We implemented an outcome measurement report, and it makes up the last couple of pages of the progress report. And it's really a numeric reporting out of who we serve, how we serve, and the number we serve. So those numbers we will look at either monthly, quarterly, semi-annually, or annually to see where we are and kind of benchmark where we are and how we're doing. Finally, the accomplishment I'll again recognize is the number of children we serve from 3 to 13. This past year, we served more than we ever have in this age group. That is again, kudos to preschool or early intervention program and our SSA department to make sure that we're handing off people well and they're getting the supports as they meet milestones. So these are just a few examples of the accomplishments that you'll see in the report. You certainly can do a deeper dive and peruse the progress report. That was literally a 30,000-mile flyover. For year 2, we can only expect to see more education, more advocacy, more provider support, so we can bolster this service delivery system that is hampered by the workforce crisis in our nation. So, and we know it's just not our industry, it's every industry. And it's also, this next year is laying the groundwork for our 2023 levy campaign. So that is right now in our front view as going down the road. We do have an accreditation survey, which is in the very near future and on our horizon, slated to occur March 1st through the 3rd. This was really our report card on how well we're succeeding with home and community-based services. The survey's outcome reflects how we do each day, and it also the processes that are in place to support every single person that comes through our doors. This survey is just 34 days away, but trust me, there's no one counting here. Not one person. And finally, expect to see a formal launch of our public awareness campaign on February 1st, literally next Tuesday. Our motto, our slogan, our messaging, and what the community, we want them to know. Because what we know about our agency, what we know about the supports we provide, is truly we are out for good. And that is the campaign. So we're very proud of that messaging that the Triad Communications organization came up with. Their advertising for her. But thanks to Lisa Paramore having a bank of pictures, they just they couldn't thank her enough for just the positive images of people with disabilities and their families. So we got some really candid shots that complement this Help for Good campaign. So this concludes the superintendent's report. Any questions, concerns, issues? Okay. Thank you.
Okay, thank you. So the committee and department reports are in our board packets. Are there any additions or deletions that need to be made this time? We do not have any old business, and the new business we have before us is the issue of our health benefits, and the county will be providing an overview of issues and costs of the alternatives.
Yep, 1 second, Connie.
Thank you. Good evening, board. In late November, the Stark County Schools Council of Governments, also known as the COG, notified us of some changes that would be taking place regarding the benefit plan. Those changes would begin in January of 2022 and continue through January of 2027. The COG is a consortium of approximately 160 agencies and entities, including Stark County school districts, libraries, many other county boards, and other type agencies, totaling 60,000 plus lives. So in announcing the changes, the COG's goal is to really try and keep the health plan affordable for its members. So here is a summary of the changes. The first change is significant to us and says basically that groups that have the COG's medical are expected to utilize the COG's dental, vision, and life insurance programs, and that is expected to happen by 2027. Now, certainly this is a requirement that all new agencies going into the COG have to follow. However, since we were an original member of the health plan dating back to 1984, we have only ever participated in the health and life insurance plans, and we've been permitted to do so until now. So we've gone out to the market, and with the assistance of a broker, we've secured our own dental plan, and we have vision, and we also have a health reimbursement account. Both of those are voluntary plans that employees can elect to participate in or not. The next change is effective 1/1/2023. At that point, anyone in the health insurance plan has to offer their employees the COG's healthcare reimbursement account And that also includes a dependable care flexible spending account. The next changes involve the deductibles and the coinsurance levels. Those will increase in 2023, 2025, and 2027. And then last, the ER copays will be implemented beginning in July of 2022. The copay will be $175. And then in July of 2023, the copay will be $250. And the ER copays are being added really to discourage people from using the ER for non-emergent reasons. And this is also going to include some education for members as well.
I get it.
Okay, sorry. So what are our options? First, we can continue to offer the COGS health and life insurance and move all of our other benefit plans to the COG. Another option would be to find insurance elsewhere. We know that the Stark County Commissioner's Benefit Plan is an attractive plan, and other county agencies are in that plan. And then there's always the possibility of partnering with a broker and going out to the market and doing a request for proposal, basically going it alone with our own benefit plans. So during the past month, we have been evaluating the Stark County Commissioner's Benefit Plan. So this plan does offer each of the plans the COG offers. And like the COG, you can't really select one plan and not the other. So it's kind of an all or nothing situation as well. So during our evaluation of the county's health plan, we learned that their plan is an 80-20 plan, while our current plan is a 90-10 plan. The deductibles and coinsurances are comparable. The county's pharmacy plan does have an out-of-pocket copay, while our current plan applies pharmacy expenses to the deductible and then coinsurance. So the orange bar that you see on this graph represents the total annual cost of health insurance. And this is based on current enrollment and premiums as of January 1st, 2022. The actual monthly premium for the county health insurance plan is definitely lower, but the overall cost is based on 12 months of premium. Our current plan is based on 10 months of premium expense because we do receive 2 premium holidays every year from the COG, and that has traditionally been the case. The county does not offer premium holidays. So you can see, it's kind of hard to see, but the county plan actually on an annual basis is about $40,000 more than our COG plan. And that really is because of the 12 months of premium versus 10 months. So if we look at the dental plan, the COG dental plan far surpasses the county plan as far as plan design, with a $3,000 maximum each year versus the county's plan, which is $1,200. The dental costs are represented by the blue bar, and based on current enrollment and also premium as of the first of the year. If you look at the blue bars, you can see the total cost of the COG plan is a little over $487,000, and that's on an annual basis. The county's plan is just under $376,000. But I think it's important to mention, and it's detailed in item 3, our current dental plan is $265,000 a year. So the COG plan exceeds our current plan by $222,000. And the county plan exceeds our current plan by $111,000. So that's a pretty significant amount. I think it's important to know that these are annual costs. These don't take into consideration the premium contribution our employees make. On the health plan, our employees pay 12% of the premium, and on the dental plan, they pay 50% of the premium. So our current life insurance is through the COG. Employees receive $50,000 of life insurance. They can purchase additional insurance by making those payments themselves. The county offers a $10,000 plan to employees, and additional life insurance can also be purchased. It would cost an employee here at the board approximately $200 more a year to get to that current $50,000 level that they're currently offered as a board employee if we were to go with the county plan. As I mentioned before, our current vision program is very popular. It is completely voluntary. We have about 230 employees on that plan. And there on the right, you can see that cost is about $35,000 a year through the voluntary vision plan. The COG vision is a much better plan design, but it's also more expensive. And you can see what that would be, again, using current enrollment and current premiums. The vision insurance is $106,000 a year. Now, the county's vision plan is comparable to what we have now. However, it is bundled with their dental plan. So if you take dental, you get vision. If you take vision, you get dental, and they do not separate. So it's a little difficult to do an apples to apples comparison regarding the cost of the county's vision plan. So here are some items for consideration, and the X was placed in either the county or the COG column based on which plan the item supported or favored. First item, the COG's benefit plan design is superior, and that's true in each of the 5 benefit plans that they offer compared to the county. Second item, as a result of the COG's group size, which is 60,000 plus, the overall risk for large premium increases is lower. There really is safety in numbers. The county does require an assessment of our workforce, and they want to look at our group claims experience to determine admittance. So there are no guarantees whether they would take us into the plan or not. Versus now we're a member of the COG in good standing. Overall, the county's benefit plan is less expensive than the COG plan. Currently, the county's benefit enrollment is a paper process. The COG is in the process of moving to a web-based enrollment process using a standardized platform, and that I believe will be finished this year. Next item, I kind of assigned the X to both columns. It kind of depends on your viewpoint. County government makes decisions regarding the benefit plans. However, on the COG side, the union does have input regarding the benefit plans and the decisions accordingly. Next item, the COG offers 2 plan options. The county offers 1 plan option. So there is some choice, and that's typically viewed as very positive. The COG's plan design has remained steadfast with traditionally low premium increases of 2 to 5%, and the county plan premium increases have ranged from 0 to 10%. And then lastly, health insurance plans through the COG have always been a recruiting and retention tool. We hear that from new employees coming in, and we also hear that from employees who've been with the agency for a very long time. And another consideration is our upcoming union negotiations, and those begin in March. There is contract language in both of our contracts that speak to various components of our benefit program. So we will have to negotiate any changes that are made that would move us away from the COG. So I'd be glad to take any questions. It's a lot of information.
When would that decision need to be made?
Right, that's.
Well, the COG has said, as far as the health insurance plan is concerned, 2027 is when they're, saying it has to be made by then. Certainly sooner could happen, but that's the kind of drop dead date. Any other questions?
We know for employees, if we were to move, say, to the government, does that affect the doctors they see? Is there ramifications like that to the employees?
Well, they offer medical mutual, and we have medical mutual now that employees are offered, though the majority of our employees are actually enrolled in all care. So, I'm not quite sure about that. Med mutual is a big big provider. There could be, but I wouldn't see it as a huge potential. Yeah.
I can say this. So next month, we'll have an executive session to talk about union negotiations. And we can talk a little more about this. It certainly is tangential in regards to what we talked about is in March. So the question is, do we make the decision during this union negotiations? If so, yeah, time would be of the essence. So. And with no pressure, please don't indulge in comments, but if, but union negotiations will start in March and go on for several months, so. Does that help?
Thank you.
Thank you. This time we'll have a review of policies like first reading. With Colleen presenting the policies.
Policy 2.10, risk management, was reviewed with the changes recommended. Policy 4.23, resignation, was also reviewed with the changes recommended. Policy 6.14, IT physical security, also reviewed with no changes. And policy 6.15, IT remote access, was reviewed with no changes recommended. Thank you.
Okay, thank you. Now we move to resolutions. We have several. Resolution 0102 approving board expenditures for December. Any motion?
Anderson motions.
Second. Discussion from me.
Thank you. Good evening, everyone. So ending out the year for the month of December, we had total local revenues of 145,000, total state revenues of 236,000, and total federal of 254,000, giving us total revenues for the month of 636,000. We did have 2 payrolls during December, totaling 1.2 million. Total benefits paid of 1.14 million, and total other expenses of 428,000, giving us total expenses for the month of 2.8 million. As you can see, our expenditures did exceed our revenues by 2.2 million. Looking over at our year-to-date at the bottom where we ended with cash, we started the year with 52.5 million. We had 766,000 in 2021 POs open at the end of the year, with 886,000 of 2020 POs canceled, and a positive year-to-date net change in position of 7.1 million, gives us unencumbered cash just below 60 million. Then again, deducting our reserve balance gives us actual unencumbered cash of just under 50 million for December. Looking at our budget versus actual, focusing on our year-to-dates, we collected 56.7 million in revenues, which is 111% than what we expected to receive, mostly due to those 2 cost report settlements we got right back in January, right at the beginning of the year. Total expenditures of 49.6 million. And as you'll notice, just about 94% of our total budget. Over on the far right there, we had a remaining budget of $1.8 million remaining at the end of the year. Our prior year encumbrance report, this has not changed. So you can see we carried over 1.14 million in 2020 POs, paid 255,000 during 21, canceled 886,000. So we had $0 remaining at the end of December. Now looking at resolution 010222, you can see our 2 payrolls there. I will note we had a vacation buyback for that first payroll. And then our week-by-week breakdown of non-payroll totaling 1.6 million. If there are no questions, requesting approval of resolution 010222.
All in favor of the resolution, say aye. Those say nay. No abstentions. Financials for December are approved. We have resolution 010322 approving a transfer of funds to the Northeast Ohio Network. Any motion to approve?
Lane moves.
Any seconds?
Move. Second.
Thank you. Discussion for Lee.
Thank you. So resolution 010322 is to transfer $212,000 to Neon for the purpose of the Family Support Services Program. So a couple years ago, we used to receive subsidy funding through DODD. However, that was basically cut from the previous state biennium budget. But we still want to continue funding this program. It's important for families. It gives them what they need, camps or respite, things of such. These funds were appropriated in our 2022 budget. If there are no questions, requesting approval of 010322.
With none, all in favor of the resolution, say aye.
Aye.
Those say nay. No abstentions. Resolution is approved. And we've got resolution 010422 approving a request to amend the table of organization to create 3 SSA positions. Need a motion to approve?
Iggy moves.
One second.
Second.
Thank you. Discussion from the county.
Resolution 010422 is a resolution to request the addition of 3 new SSA positions in 2022. The Service and Support Administrator serves as the point of contact to assist the individuals on their caseload in coordinating all the services they may need. The addition of the 3 SSA positions is needed as we increase home and community-based service waivers in 2022. The expense associated with the addition of the 3 SSAs is included in the 2022 budget. Once the positions are approved, they'll be assigned a position control number and will be placed on our table of organization. Any questions?
Any questions? All in favor of the resolution, say aye.
Aye.
Those say nay. No abstentions. Resolution is approved. Resolution 010522 approves a request to implement an SSA incentive program. Any motion to approve?
Anderson motions.
Any second?
Here's second.
Thank you. Discussion to the comment.
Resolution 010522 is to propose the implementation of an SSA incentive program not to exceed $75,000 a year. And this would be for eligible SSAs based upon established tiers for accomplishing targeted case management productivity percentages. So targeted case management is also known as TCM, and it's how SSAs document the services provided to the individuals on their caseload. Some examples of those services include assessment, care planning, and monitoring. Most TCM services are reimbursable through Medicaid, and TCMing is an extremely important revenue stream. The current Medicaid reimbursement rate for each 15-minute unit is $19.50. So some TCMing is not eligible for reimbursement, but both allowable and unallowable TCM will be measured for the purpose of the incentive program because both tell the story of the person being served. So the way the program works is that TCM productivity will be measured at the end of each quarter and based on a 3-month average of SSA productivity. A productivity standard has been established in the state of Ohio, and that is 47%. That's based on an 8-hour workday, and the standard does take into consideration time off. So increased productivity will result in increased revenue and will offset the incentive payouts. So as an example, based on current TCM productivity, we have 22 SSAs with a productivity level above the 55%, which is the first tier on the incentive payout chart. And you can see that on the screen. The annual revenue generated is approximately $173,000. So you can see the productivity tiers and the incentive payout. Of course, 47% is the threshold that is required. The next tier is 55 to 59.99%. That would result in a $250 incentive payout. The next tier, 60 to 69.99%, would result in a $350 payout. And then the top tier is 70% and above, and that would result in a $500 payout. So incentive payouts will be made the month after the end of the quarter. And the maximum, of course, somebody could receive would be $2,000 per year. Any questions?
Is this something that other counties are doing as well?
I really don't know that they are. We certainly have looked at this kind of program for a while. And, certainly the program is self-sufficient. And because of the increased productivity, pays for itself. We're always looking at what we can do to be more competitive. We have seen some turnover within our SSA department. So we're just trying to do what we can do, hopefully, to not only make them more productive, but to be, I guess, as a retention tool.
I can say that other county boards might not have a specific incentive plan, but they do have kind of pay for performance where everyone would get like a 1%, but based on productivity, community activities, they could work or another too. Yeah, so it's not exactly what we do, but there are many merit pay models out there for SSAs. This is just one that we did many of this quarterback 14 started to work on.
At the 70%, it would be just a very small number, couple, yeah. But there are about 22 or 23 that fall at 55%. Yeah.
Three.
What's the productivity reported or tracked?
Well, they would basically be doing, it's like case noting. And so it's measured through a computer system. And our finance department actually produces the quarterly reports.
Yeah, at the end of each month, we run basically a detailed report that lists each SSA, the allowable, unallowable units that were generated. And we have put that into a spreadsheet and we monitor their productivity each month. And then of course, at the end of the 3-month period, we'll calculate that average. And supervisors get that information about the 6th or the 7th of each month after the month end.
Thank you.
Well, just as a clarification, the more we build, the more we serve. In this case,
Or we build.
the more services get.
Correct.
Yeah.
Right.
Any other questions or comments? That all in favor of the resolution, say aye. Or say nay. No abstentions. Resolution is approved. Resolution 010622 approves a request of the Board of County Commissioners to go out and bid for the resurfacing of the parking lot at the Eastgate of the Child Center. Any motion to approve?
Calvo Lang moves.
Second,
Anderson seconds.
the discussion from Lee on behalf of Tim.
Thank you. So resolution 010622 is to request to resurface the parking lot at Eastgate at a cost not to exceed $200,000. This does include architect and engineering fees. We have appropriated this in our 2022 budget. I won't get into all the details below, but basically we've been patching the parking lot for many years. And the whole parking lot has not been redone since 1996. So it's just, it's about time to, and then Tammy's gonna have another project in Eastgate as well. But just time to resurface the lot, just like we did at Whippledale. So if there are no questions, requesting approval of 010622.
No questions? All in favor of the resolution, say aye.
Aye.
Or say nay. No abstentions, resolution is approved. Have one more resolution before second readings. Have you resolution 010722 approves a request of the Board of County Commissioners to go out for bid for resurfacing of the playground Eastgate for the chapter 7. Need a motion to approve?
Not motions.
The second?
Smith second.
Thank you. Discussion. Okay.
Good evening. As part of our preschool licensure, we are required to have a fall safe ground level or surface for the kids if they fall, that kind of thing. We could use mulch, we could use pea gravel, we could use sand, but that makes it difficult for children with wheelchairs or walkers or ambulatory gait issues to traverse on the surface. So 25 years ago, when they remodeled the building to be an early childhood center, they installed a rubberized surface, and that is the same rubberized surface we still have in Eastgate. As with the parking lot, it has been patched and patched and patched. I think there are more patches than there are original surface. The patches with the glue they put in it, it is not nearly as soft as a fall surface as the original rubberized surface. And it easily is peeling now. Kids are putting it in their mouth and chewing on it. I walked out one day and a child had a pretty large piece and was using it like a Frisbee. So it is more than past due to have the rubberized surface replaced. So we are requesting that the board approve funding for the Eastgate Playground Resurfacing Project at a cost not to exceed $70,000.
Any questions? Other discussion? All in favor of the playground resurfacing resolution, say aye.
Aye.
Say nay. No abstentions. Resolution is approved. Need to play safe. Now move to second reading of board policies presented at December board meeting. Those will be presented by Chuck.
Policy 2.20, Medicaid HCBS waiver waiting list, along with policy 2.21, non-residential waiting list, policy 4.49, dress code, policy 4.51, employee conflict of interest, policy 4.55, certification, licensure, registration and permits, policy 5.18, transportation, and policy 6.21, breach notification, were all reviewed with no changes written.
And it brings us to resolution 010822, providing approval for board policies presented for second reading. Need a motion to approve?
Iggy moves.
A second?
Smith second.
Any further discussion? With none, all in favor of the resolution for approving second readings, say aye.
Aye.
Opposed, say nay. No abstentions. Board policies are approved. Okay, now need a motion to adjourn.
Ballard first.
A second.
Anderson second.
Thank you. All in favor, say aye.
Aye.
Opposed, say nay. No abstentions. We are adjourned at 6:56.